Thank you very much for the kind invitation to present to you all today. Delighted to be here, delighted to get the break. As much as anything, as I was joking with my colleagues, it would be lovely to take some time to actually reflect on what we've been working on and doing for the past number of weeks and months. So yes, we've had quite the crisis and quite the response in DEASP. And what I'd like to do today is just take you through my own department's engagement, talk about what we've done, talk about the learnings we've had from it, what we know we could do better, how we've moved our services to meet the surge in demand, which was quite exceptional, and what we've learned from that overall. So I'll just give you a whistle-stop tour. In terms of the first 100 days, here we are. We are just 100 days out from the beginning of this crisis. And on reflection, it feels like a lot longer, and it feels like a lifetime ago since we began this journey and when we began with Ireland's first case of COVID-19. That was in week 10 on this graph here from the Health Protection Surveillance Centre, who have been doing a marvellous job in monitoring the data and the health protection advice that they've been giving to the public service and wider public. So you can see that we really have managed in Ireland to flatten that curve. That was the objective. And where we came from in March was a very frightening time in terms of our ability to, or otherwise, flatten that curve. Sorry, Ned, bear with me. Come through. And just to go back to everyone and say, do you remember March? Do you remember the headlines we had at the time? Do you remember the fact that we were seeing devastating news from around the world? Particularly my own memory is of the stories coming out of Italy and Spain at that time, how utterly frightening the news cycle was, how scary this was for everyone in terms of news, no matter how positive or brave they were in their personal outlook. This was an exceptionally frightening time with a new virus having devastating impacts across the world, and Ireland sitting in a position, I suppose, to some degree, waiting for the impact to happen here. So between late February and mid-March 2020, DEASP was aware of what was happening and closely monitoring the situation. In late February to mid-March, it became clear that there was going to be an impact for Ireland, and we were more in the market or in the position of when as opposed to if. So our first focus, which ended up being slightly different to where we ended up, was on the potential increase in illness benefit claims by virtue of people who became sick with COVID-19, who needed illness benefit support because they wouldn't be working, and how we would wrap our services around them during a time in which phrases like social distancing, physical distance were emerging. Also, a big focus of the department was how we would keep our own staff safe, and the physical separation of key teams began to be planned. So at that point, we were still expecting the impact for the department to be very much in the illness space, illness benefit, and we were very much looking at how we would put together our own team to deliver that illness benefit service. So in late February, we established a dedicated COVID-19 phone line with 8 to 10 staff, taking staff who are currently working in another business area in the department on the Jobs Ireland team and dedicating them to a new service to answer calls or inquiries from the public around COVID-19 and the income supports available. It was very important that at this time particularly, I think I really want to stress the sense of anxiety around COVID-19 and the sense of how the media were treating known cases. It's very different to where we are now in terms of the coverage. And this was, I think it was quite difficult for people or anyone who was sick around that time. I remember thinking it's very difficult to be one of those first cases, as you know, case 1, case 2, case 5 are noted in Ireland, and people talk about whether it was in Munster, are they in Limerick, is it in Dublin? There was that kind of atmosphere around it. So we developed a careful customer service playbook for our customer service team with a real focus on data minimization. So when somebody called up and said, I'm ill or I'm self-isolating because of COVID-19 or a fear of COVID-19 or I'm in close contact with somebody, that would be really empathetic to them, knowing that that was the position they were coming from, that they're likely to be very frightened, very worried, and feeling very exposed in terms of how the media and other coverage was happening. So that playbook that I referred to was a kind of a manual for our staff in terms of engagement for various different scenarios, primarily related to illness benefit. At the same time, my own internal communications team, I head up the communications and customer service unit. I have responsibility for all communications and customer service activities and policy in the department. We joined up with the health and safety team, and we had this tiger team, as it was called, established that would have a meeting every morning, 9 o'clock, and began to work on our internal communications for staff and staff preparedness. And at that time, you might remember, it was kind of the guidance was coming out if you had visited one of these regions, or if you'd been a close contact of one of these regions, or here are the symptoms. We were just at the early stage of communications in a national and from the Department of Health perspective then. The focus very strongly on office safety and our own staff protocols. And information then for our frontline staff in our intro centres. If you think about it, intro centres do the work of registering people for personal public service numbers, PPSNs, and also public services cards. There's a lot of direct access or access to individuals travelling from overseas, first time in Ireland, here to take up a role or a job. That presented a particular risk, so there's a particular focus on the needs of those staff. And we started to share daily updates via the intranet and an email, coronavirus as it was then. We started with coronavirus, as you'll recall, and we moved to COVID-19 later. And by mid-March, we were sharing Department of Health advice pretty much daily. The key dates for us in March, I just want to bring us back to this again because I think the context is important. Around the 9th of March, up until that point, the discussion across Ireland was, will St. Patrick's Day be cancelled? I think in retrospect, it looks quite insignificant in terms of what the country has gone through since. There were very significant loss on the tourism side and the economic side, and indeed the societal benefits from that. But remember, that's just where we were as early as the 9th of March. On the 11th of March, the World Health Organization declares an official pandemic. And by the 12th of March, Ireland moves from that phase of containment to delay. And they were the very significant dates of the gearing up within Ireland. And we began to see posters and communications around COVID-19. And if you have a fever, cough, stay at home, and all the public advice coming with it. And today's cases reinforce the necessity of the measures put in place last week. Dr. Tony Holohan begins to become that household name that he is today. So DEASP actions around this time. Our big focus was on the health and the societal impacts of COVID-19. And firstly, we were really still looking at illness. But soon it became very evident from mid-March on that the range of restrictions that were coming into play in terms of social distancing would potentially mean that the surge in demand would come on the income support side, unemployment, temporary unemployment, layoffs, and an economy struggling to work within social distancing regulations and then ultimately deal with what became known colloquially as lockdown. So the focus then was quickly on delivering income support and services at a very big scale while keeping our own staff safe and knowing that our own staff would not become immune to the effects of this pandemic over time. And the focus of this department, which I have to say has always been so strong, is that it gets people who need payments into payment. It delivers income support well and quickly. And that's a real core value of the department. It's an unspoken one in terms of our values, but it really is. We will help you quickly to get you into payment as quickly as we can to provide income support for you. So there was decisive action around that time from government and with a significant impact on our department in terms of new schemes and services being developed. We had an enhanced illness benefit payment developed, and that was announced on the 12th of March. The idea of it being enhanced was there was no waiting days. Previously, if you were taking an illness benefit or you were out sick from work, there were 6 days where you don't get paid by our department, and thereafter you'd be paid a 203 rate, 200 euros or so rate per week. The enhanced illness benefit had no waiting time, and it was at a 305 rate. That 305 rate was a strong, I think, signal to society that if you're sick, we want you to be at home. If you're sick, we want you to be able to afford to be at home. So that enhanced payment was very important and a very strong signal of if you're self-isolating, if you're ill, please stay home. Here's the money to enable you to do that. Made available to self-employed and employees, unusually as well. Normally, it wouldn't be available to the self-employed. You're very familiar, sure, at this stage with the pandemic unemployment payment. Over the weekend of the 14th to the 15th of March, that was developed. And I remember it very clearly because following a management board decision, I think around 6 o'clock one evening on the, I think the Sunday, the 15th, I was asked to have the press, the online, the comms, the form ready for an announcement by Ingrid Miley on the 9 o'clock news. And I remember ringing the team, and we were already, some of us in the office working already that day, and we're working closely with our management board and saying to some of them, get in, I need you to be in, I need forms done, I need a website done, and I need customer information available, we need to coordinate with the press. So really busy time. We knew Ireland was going into a different phase, and we were preparing the income supports to support people through that phase. Thereafter, both payments, both the pandemic unemployment payment and the enhanced illness benefit payment were increased. And very quickly, 4 to 5 days after the launch of the pandemic unemployment payment, the online application for the payment goes live on the 19th of March. Exceptionally short delivery time for a scheme developed on a Saturday, Sunday, and live by Thursday. So in terms of our digital team and our digital response, that was hugely important and hugely strategic in terms of the department's response. Also to say, when you create a new payment, it wasn't a scheme as such, and I shouldn't call it that. When you create a new payment, suddenly you need a form. You need a place for that form to be sent to, the physical paper form. Where does it come back to? Suddenly we were thinking of how do people get that form back to us? What's the email address that we used for people to request forms to stop them ringing us? How do we deal with all of this? So there was a lot of considerations around the customer service pieces. It isn't like this was a service that simply existed before and we could just promote. It was entirely new. All the customer service pieces around it had to be developed and thought through. So there was a huge focus at this time, as you can see, on the customer needs. And on that 16th of March, the Monday, the pandemic payment was live from the evening before, from the 9 o'clock news. And our first national public information campaign goes live. Now, that public information campaign doesn't reflect the pandemic unemployment payment specifically, because it actually, by the time the advertising is booked in on Saturday night at 9 o'clock, that payment wasn't actually in existence. We wanted to have an ad in the papers, and over the weekend, I changed what had become the COVID-19 line focused on illness benefit payments to an income support helpline focused on income support for people who had lost employment more so, but also serving cohort who had been affected by illness and receiving illness benefit. So this new income support helpline is in place pretty much overnight. We rename the other, we record the IVRs, we put it in place, we get the income supports, and I have a team of 10 of my own staff and 10 of the staff who are already on the line from its start working on it. And by the middle of that week, calls to that phone line reach 5,000 per day, and we think, wow, right, this is really, really gearing up. And I'll talk you through our response and how we dealt with that thereafter. In terms of communications around this time, we really pushed the message on communications to ensure the customers and the public were aware of what income supports were available to them. They were aware of how quickly and easily they could apply for them online where possible, so that there were always other routes available to them if they could not apply online. That's really important. We know that not everyone in Ireland has the capability to make an online application or the access to do that. And we communicated intensively. I think in around 7 weeks, we had about 5.5 different communication campaigns. The half in there is saying that for the first 4 days of advertising the pandemic unemployment payment, we were pointing people to it online, to the online form or the paper form online. And from the end of that week, we dropped in new advertising into that campaign to say, please now go online. You can now apply online. The tweet down at the bottom left of your screen was a promoted tweet for the pandemic unemployment payment and received just shy of 1 million impressions and about 30,000 engagements. So the scale of engagement with their communications was very, very significant and quite unprecedented for us. So the applications to the department, they came thick and fast, just like the calls. Everything's beginning to scale up in that period between mid and end March. We processed 389,000 applications for either the COVID-19 payment or job seekers benefit between the 16th and 30th of March. The online application, as I mentioned to you, was available 4 days after launch. That is a normal 19-month claim load for a department, which was done in 10 working days over that period. The adverts strongly supporting it, and 40% of our applications were received online during that period, which is quite significant and very important for us in terms of the ability to manage paper applications versus the ability to manage online applications. In terms of information demand, so there's service demand, there's information demand, Gov.ie as our information source. I was incredibly glad that we had made the move as a department to Gov.ie since December 2019, and quickly in mid-March, around the time when we were getting all our new services and supports, the enhanced children's benefit, the pandemic unemployment payment and so forth in place, it was really important for us to create a presence online where employers, employees and the self-employed could go for every piece of information they would need to find on income support. So you can see on the right-hand side of the screen, that's our page, the Gov.ie page with all the information available there. How to apply, how to stop your COVID payment, that's since come up, apply for illness benefit for COVID-19 absences, information for employees and the self-employed, and a range of scenarios. Particularly, you may have heard issues around people returning from maternity leave, people who've been on career breaks, how to handle self-employed versus employees, information directly for employers, and ongoing customer service updates. We created this entire new COVID hub and a lot of work in keeping and maintaining that web presence, as you'll have heard from our colleagues similarly in the CIB. That's a huge task. When information schemes are evolving, changing, being developed, increasing in value, when all of that is happening and you are washing changes repeatedly through your web and other content, the alignment there is a huge challenge. When the COVID-19 pandemic unemployment payment, the application form went up on gov.ie originally, on average, a form was downloaded every 10 seconds in the first 48 hours after launch. So it's really significant in terms of demand. So I might just give you an example here of some of the innovations, big and small, around this time, and some of them made me smile to remember. In terms of the department's response, what I'm really most proud of in terms of it, that at every piece of it, and my piece is only one, this is only one strand of a service, even though it is part of, and it's one of the frontline national responses, the illness benefit team and all the other operational areas are still managing their own response and dealing with huge volumes of inquiries themselves. But this was the collective national presence in terms of customer information and support through the income support helpline and the other engagements over email and phone. We did everything with the customer journey in mind. The COVID-19 pandemic unemployment payment, the physical form, is a one-page, very simple application. We looked for the most basic details to get people quickly into payment. The new online application for it came simply within 4 days, up, built, done. For people who would traditionally have received, have gone to their doctor traditionally and gotten their illness benefit form there, the doctor would put, half the physical form in, give you your cert, you take the other, fill it out, send it back to the department. No one was going to be visiting a doctor anymore. How are they going to get an illness benefit form? How are they going to actually apply? How was their GP going to certify them? Thankfully, the department was already in a process where we had a lot of GPs in Ireland certifying illnesses online since about 1.5 years ago. And we created a special online certification for COVID-19 illnesses, which also helped with tracking illnesses and diagnosis around that. So we had very good data coming through to us, and GPs would make a certificate and do that certification process online. And then we, which we never did before as a department, would post out the other side of the application form to the customer and say to them, you need to return this to us. So a different way of engaging. And then we thought, when the form gets to the customer, how do they get it back to us? Somebody's sick, they can't, leave the house. Well, we'll make it free post and we'll let them pick it up through the on-post collection service. So just stepping through the customer journey in terms of someone sick at home, worried, needs an illness benefit application, how do we get that to them seamlessly? Equally, we would help people and support them over the phone in filling those forms out. We would have them or a family member drop them back to intro if absolutely necessary, but we were asking customers to use the free post service that we put in place and promoting that widely. For our own team and for the teams that we brought on board, and I'll be showing you a little more about this shortly, we developed an internal power app for payment status lookup. Over the course of this last 2.5 months, I started from a team of 20 people on a helpline and moved to a team at one point of 350 staff. working in various roles in terms of supporting customer information and income support information specifically. Not all of those 350 staff, in fact, many of them would not have been in customer-facing roles before in the department. They wouldn't have access to department systems, they wouldn't be able to do the lookups, they wouldn't know where the data would be. And we developed a quick app where all pandemic unemployment payments and the status of those payments could be checked. So when a customer rang, our customer support agent could quickly say, I'm going to look that up, I'm going to take your PPSN, do the necessary data for verification and say, oh, I can see actually your payment is processed, it'll be in your account on Tuesday. Or actually, I can see you've been transferred to the wage subsidy scheme, your employer seems to be paying you, that's why we stopped your payment. Or actually, your PPSN was wrong, or we need to update your address, or wherever a bit of friction happened, there was a status there. And that app has been invaluable, and we have refined it and added to it over a period of weeks. Equally, one of the important pieces, if people collect social welfare payments as they do at post offices, what about people who didn't want to come out at this time? What about people who are elderly, maybe vulnerable, maybe ill? We immediately made a change to allow post offices to hold payments for up to 90 days. So people didn't have to worry. If their payment wasn't collected a particular week, and if they could afford for it not to be collected, we'd keep it there. There was also an ability to nominate an agent to collect their payment on their behalf, and there was also the ability to quickly change to EFT payments for all social welfare payments. So people could be paid into bank accounts for all social welfare payments. Again, this wouldn't be the norm for job seekers payments, which are usually collected physically at a post office, but given the COVID and the health, COVID environment and the health concerns, that was considered a necessary innovation. So these were all small and big pieces, but together, kind of wrapping ourselves around the customer to deliver the best service this time and think of their experience and their needs. Another arrangement on the innovations big and small was to create a double week payment, again for people to collect 2 weeks payments out in 1 week, were they to be collecting, physically collecting a payment to reduce the number of interactions they were required to have. For forms that customers needed, one of the issues that we realised quickly was that lots of customers have access to the internet, lots of customers can get forms online or can find them. Not all customers can print them. Quickly from the date of the launch of the pandemic unemployment payment service or support, I turned to my design team and I said, right, you are now the forms dispatch team. We need to get a forms dispatch operation going. And the team said, no problem, here we are, what can we do? Set up a forms@welfare.ie mailbox that was running from the first morning of the pandemic unemployment payment. And we have dispatched and managed requests for thousands of forms from the department since that date. What was really heartening for me, from my team, was that traditionally in our Áras McDermott building in Dublin, the post collection is around 3:30. And we realised that we really wanted to get forms out quickly, and the surge for forms was very substantial at the start. And if we could get a second post collection that day and ask on post to come later, we could get more post out. The trouble was the staff who worked in the post room were gone at a certain time in the evening. They were in early and they were out after 5. So my own team said, no problem, we'll frank mail. You know what, you want us to get forms out? I was a graphic designer yesterday, I'll be in here, I'll get the mail down, we'll do a second mail run. Because that team was hugely committed to making sure that if we could get a form out that day, we got it out that day, especially if we knew it was a Thursday and there was a surge coming. Also, when after we missed the post and the deadline was gone for the day, staff would stay back of all grades in the offices, stuffing envelopes, chatting to each other, having the envelopes ready to go the next day with the forms in them so people could slap an address on them and get them out really, really quickly. Free post for all forms being returned. We had to bring on post up and say, I'm putting free post 1, 2, 3, 4 in this envelope. Can you figure out how to charge us for that when it comes into this department? We can't have people standing in a queue for a stamp to send a form to us at present. So all those small pieces in terms of the customer journey, we're just trying to think, what are the problems in the customer making an application? What could come in their way? What can we do to ease that? Furthermore, very mindful that people might have exceptional or urgent needs for payments during this time. They may, for whatever reason, it may take time to get them into a payment. They may not qualify for a payment. There may be certain issues. They may have an urgent income need. Quickly on the phone lines, we established with our colleagues across Intro, across the network, across the country, a process by which we could access community welfare services for individuals with a 24-hour response time at the maximum in terms of response to that customer. So we would escalate and triage community welfare officer requests, or from people who we knew were in trouble, and we'd suggest to them that we put them in touch with their community welfare officers, and they would get a response within 24 hours from those community welfare officers, who could then in turn make a payment direct to them, and also innovated in the way they supplied income support at that time. So my coordination role within the National Customer Service Response, and that's the income support team. And why was a National Customer Service Response needed? I think this is very like what was said by our colleagues in CIB. We needed a place where we could provide info and advice on income support available, and the application processes and triage for emergency payments if required. The idea was, in creating a national income support helpline, that we could support our intro centres, reduce footfall to them, help with social distancing, and help with the compliance in terms of the health advice at that time, reducing the need for in-person attendance. Let the intro centres then get on with physically processing paper forms, dealing with issues of payment fallout or failures or issues, while we would stand in front of them and take the customer calls and triage and manage those as well as we could, to give them breathing space to do the important processing role that they could do. Also, creating a customer service team where customer service is the only focus means there's no competing priorities. If that had been at the intro, and an intro centre is sitting and there's 500 phone calls coming in, or there's 500 applications sitting on the desk, they have to choose which one to allocate their resources to. If we can take customer service out of that environment and put dedicated resources in place for it, then there's no competition and we can serve better. Also, very conscious that we wanted to be aligned for people who were ill and medically required to self-isolate. A lot of concern about their ability to access the departmental services and have a dedicated line where they could get through. Where we could also, as a team, and number 5, support online applications, where people were nervous or not sure if they were applying correctly, talk them through the process, hold their hand, and if they didn't want to apply online or couldn't, absolutely support them through another route. No issue at all. Equally, we were aware in developing this team and structure that we were a safety net. We're a geographically dispersed team. So my National Income Support Helpline had teams logging on from Ballina, had teams logging on from Swords, had a team logging on here in Dublin, in Eden Derry, large geographically dispersed teams with support from teams in intro and also with support from other organisations, as you'll see shortly. And that spread risk. We weren't all in a single contact centre in the middle of the country. If one area was impacted by an illness or an outbreak of COVID-19, as happened in one of our offices, we could then respond, we could scale up elsewhere. It was like putting those fire breaks in place. And really, the National Income Support Helpline, I firmly believe that in times of crisis, a government has to stand up and have to say, we're here for you. And I think it was a very strong signal that, yes, we recognise that this is a crisis. Yes, we recognise there's a huge level of uncertainty and anxiety. We're creating a specific response to that need. I think that was really important. So my own income support, virtual and dispersed team managed phone inquiries, email inquiries, social media inquiries, and those forms dispatch requests that we talked about. And you'll see there by Monday, the 6th of April, more than 700,000 people in receipt of income support. Really substantial growth in demand, really, really quick increase in payment requests, and a need then for us to respond and quickly scale up. So at the start of this period, at around the 16th of March, I had 20 people working on an income support helpline, and by about, and another probably 5 to 10 working on forms, or about 5 actually working on forms and other support services, emails and social media. By mid-April, I had 350 people spread across various roles, not all on calls at the same time, but all in customer service roles. So to quickly, within a 1-month period, onboard, train, train, onboard, support, engage with, and deliver good customer service to a team that has expanded exponentially was quite the task and quite the challenge. but we really got there, and I'll give you a little bit of the story of how that happened. So we could quickly see from those early stats that there was a need to upscale our customer service response based on the volumes of customer contacts. 20 people cannot answer 5,000 calls a day, even at a very good call answering level. In the early days, which we saw with many of our team members, up to 100 calls a day at about a 3 or 4 minute call, still you're not reaching that level. And the calls become more complex and longer over time. In the early days, they're very transactional, information-based. In March to mid-April onwards, the calls and the nature of them changed. I'll chat you through that in a few minutes as well. So the need to upscale was based on early volumes of customer contacts. I had redefined the roles of my own team, as I said to you. Graphic designers were suddenly formed a dispatch team. I was given 5 new managers to the customer service team. HR moved mountains for me, and they said, look, we can give you, how many staff do you need? We have them. They stood down work in areas of the business that was considered not critical at that time, and they gave those teams to me, very importantly, with managers in place to onboard, so I could work through supervisors. We could put structures in place. We were given a team from the Department of Justice who ultimately became our foremost dispatch service in the department, with support from my team, bringing other people in my team back into new roles. So within this upscaling, we were really building the airplane while flying it. We had new people, new teams, new roles, new technologies, and new work. There were processes and reporting systems developed, hourly, daily, and weekly metrics used, calls, mails, escalations, social. What is hitting us? Where are we today? And what we found during that period was the first hour of the day was really indicative for us on the volume that was going to come and hit us, and what lay ahead for the rest of the day. So if we knew in the morning that we got 500-600 calls within the first hour, or some days 1,000 calls in the first hour, that was going to be a very significant day, and we needed everyone on board. And because of the need to have everyone on board, we managed very closely staff rotas and staff availability, and we very much watched the metrics and how we were performing. So just to talk to you about what we delivered over that period of 16th of March to May. In total, it counts as 211,000 customer service engagements. And you can see them broken out there by income support calls, customer emails, and forms dispatches that were requested, requests for forms dispatch, which we handled also. So immensely significant if you think that there was 10 working days in March and just around 50,000 customer engagements. And these are what we answered. These are not what was offered. There was a large volume of calls which weren't answered, which we know sat on servers, because at one point in one particular day, our level of traffic on a number of days was bringing down the network within the department, the level of traffic coming through, and we had to put in place a call queue within the department. So we quickly put that team and grew it in place and put the protocols in place, and I'm just going to talk to you a little more about how we did that now. And how we supported our customer service teams to deliver. So suddenly we were given all these people, all these new teams, and we were told to configure. So the first thing was, the alignment and coordination across multiple business areas. I suppose I should firstly address making sure all the teams were on the right page at the same time, from everything from press to advertising to marketing to communications to operations to intro. This department needed to speak in a single voice, and we had the job of coordinating that. To work with these new teams, people who had never worked on a customer phone line or engaged with customers before, we firstly had to give them access to the Avaya system, make sure they were comfortable with logging in and out and taking calls. Thereafter, we had to create a playbook for them, which insofar as possible gives them the beginner's guide to every question a customer could possibly ask you and every answer you need. We also did a customer service training module about the tone of engagement we wanted on this phone line, the level of helpfulness, engagement. We're here to help, we're here to support, we're here to reassure, even though this is a difficult time for the people offering those services also. So that playbook and certainty. And even when information is changing, tell staff the latest position. Even if you've no update, tell them you've no update. Tell them it is as it was yesterday. And we had daily interactions and quickly onboarded teams and supervisors. Our IS and our Unified Communications teams and Vodafone were amazing, getting staff logged into into Avaya systems, into Vodafone, into Scale-Gov, and online incredibly quickly. We let staff self-serve for information. We developed a SharePoint team for the customer service staff where they could ask each other questions, where we shared updates, where everyone's rotas were clearly laid out, when staff were handed to us to work with for this period, we consider them our team. You're now in our team. And that was a really important piece as well, which I'll speak to in a little bit. Just conscious of time, and I'll try and keep moving through this now for everyone. But also, we brought on additional staff from the National Shared Service Office, the Passport Office, and an outsourced provider, Abtran, as well in mid-April, in addition to our own staff. And for each of these organisations, they had a dedicated on-site or on-call DEASP liaison, their own supervisor in effect from DEASP for all questions and answers or tech issues arising with them. We developed escalation handling processes, and our calls, initially we didn't need escalations, initially it was all information-based. As we got more into April, it became trickier issues, customers who did receive a payment, who didn't, whose employer had registered with revenue, but they weren't getting paid from their employer anymore. They weren't delisted off that system. So when they applied for the payment with us, they didn't get one because we had them down as being paid by revenue. More complex issues emerging. And I think we were about 1 week late in having our escalation team in place, but we got there, and that was a big learning for me. Also supporting the team and knowing that it's a difficult time for everyone to deliver, and that there had to be flexibility, work patterns and times. I don't mind if somebody answers a customer email at midnight. I don't mind if someone answers a customer email at midnight or at 10 o'clock if they have to work around childcare or other issues in their own family life. I just want to support them to deliver. So in terms of supporting the team, I think that's really the summary. That just to say to you that the most important learning, I think, from this for me is that customer service is really difficult at this time, but it's really valuable and it's really personally rewarding. And our staff were really keen to deliver. They worked out of their skins. There were people I had to send home who were calling customers back at 7, half 7, 8 o'clock at night because they really just promised they'd get that call back that day. And it was hugely rewarding to see that. So what helped us, and just to the last slide or two, what helped us in this place was that strategic thinking around our customer contact and how we were going to set up such a line was already well developed. I was lucky, our thinking on the income support helpline or a configuration of that was already done, and that we had developed a customer contact strategy earlier in the year in DEASP and had it approved at management board. The entire organisation was on the same wavelength in terms of where customer service needed to go by phone. We were given committed support and resources from HR and our management board. We formed new teams, and we actually made them new teams. We spoke with our supervisors and staff every day on conference calls in the beginning, really close management, clarity on resourcing and rotas, and clarity on expected performance standards from the outset. You can see we measured every phone call, every email, and every form we sent, and we know who did that work. Staff onboarding was very fast in terms of technology and training, but it was comprehensive, and we continued to support it. We had staggered start times for in-office starts to manage social distancing and arrival times, not having large amounts of staff physically coming into offices. We closely coordinated with the business areas we're supporting, and we know that technology can help you and both limit you, and that you can also be the limitation. At some points, the block in the system was the ability of my team to quickly onboard staff as quickly as we could get them. But we can support staff to do a great job, even when they're brand new to a CS role, and I've seen lots of examples of that. The feedback from the department, I think my favourite one is free post, your legend philosophy, which made me really smile, and there's some really nice comments in there. So, really, really pleased to see the feedback that we got from lots of individuals, and much more praise and thanks than we would ever expect as a department, who doesn't always feel like the most loved, but the public outpouring was really exceptional, and we were really grateful for it. So overall, my short recap, and I know I'm up against the time, Declan, my apologies, I'm never short-winded. Your organisation has to be agile and able to pivot. It has to be ready and willing to do that with you. You must have your strategic thinking done in terms of how you would configure a service. We were lucky on that. You cannot manage what you cannot measure. We got the resources we got because we were able to show the level of demand we were experiencing across all those platforms. Data points are essential. You must manage the data and know where you are in the journey, even more so in a crisis. When you're developing your response, step through the customer journeys. How is the customer going to get that form, going to get that payment? How are they going to do that? What if their family is sick? What if they're alone? What if they have no transport? What are the scenarios we need to think of? And talk through the customer service team scenarios. What likely questions will they get? Build the customer service team playbook, update it regularly, and check in daily with your customer service team. And out there, what your PR and advertising promises at this time, your customer service team and your department must deliver. And most importantly, I think I've learned that people really enjoy contributing in a crisis, and they really enjoy this work. Thank you very much for listening to me. I'll be delighted to take any questions afterwards, and I will hand back late, and I'm sorry, Declan, with my apologies, hand back to you.